Hi, this is Mary Cernava. I'm going to talk about pain management today. The purpose for this program is to provide evidence-based information to the nursing workforce to align with the organization's mission, goal, and vision, to understand the bigger process in pain management, to the stakeholders involved, and the resources needed to achieve excellence. The program objectives are to engage the staff by partnering in strategies to improve the outcomes in pain management. The framework includes a SWOT analysis to identify the strengths, weaknesses, opportunities, and threats that will assist in the development of the strategic plan. Again, the development of the plan will improve the safety and quality that can increase patient satisfaction, staff autonomy, and empowerment. The framework includes the transformational leadership that inspires staff with a vision and encouragement that enables the nurses to develop knowledge and skills to act autonomously. Kirk Lewin described change as a three-part process. In order for change to occur in an organization, the nurse leader needs to prove that there is a need. This is called the unfreezing phase. This presentation intention to demonstrate the safety and quality of care validated through documentation. The program's intention also is to improve the reimbursement to meet the organization's financial responsibility and resources. The impact of the plan affects the stakeholders who are part of the target audience, the board members, the patients, the family, and the community. Some challenges to pain management is discussed. The rising opioid disorders. The Center for Disease Control discussed that opioid disorders are overdose, overuse, and underuse. Another challenge is the lack of documentation. It causes consequences such as that affect the financial aspect for the organization. It becomes troublesome for the patient's treatment plans. Other barriers in the treatment of patient's pain is the staff's reaction or prejudgment of the patient's pain. These misconceptions can place a barrier in relation to providing appropriate pain management. Pain has been defined as what the patient says it is, existing wherever he says it does, and further expounded that they have the right to be treated for any pain symptoms. Some patients carry on their daily lives with little outward signs of pain, and providers may not believe the patient's reported pain. Some other patients struggle through their day, and it's easily believable that the patient is in pain. As healthcare providers, we must collaborate and discuss our own perceptions. Put our pain values and beliefs on the table. The guidelines are set up to protect the patients as well as us. This will determine the patient's needs. We need to document, report, and treat the patient's pain. As healthcare workers, we need to be self-aware of attitudes, prejudices to pain and medications, and the patient's diagnosis. The providers need to be aware of the attitude, prejudice to pain medications, and the patient's diagnosis. We really need to stress how important it is to be self-aware of the stereotypical assumptions. Safety, quality of care in pain management. The collaboration of the team of nurses and physicians must use the pain management guidelines set up by the organization to ensure patient safety and quality of care. The takeaway from this project is to provide education for healthcare staff to advocate for patients and to improve quality of care for patients. The strategic steps to build or develop a safe culture in the healthcare system. Galatians 6:9, and let us not grow weary while doing good, for in due season we shall reap if we do not lose heart. Well, during the healthcare workers' day, it's a routine and sometimes becomes repetitious. As healthcare providers, we need to adhere to the policies. As Christian nurses, a work-life balance of self-care as exercise, eat right, rest, and practice some form of meditation. Developing a sense of self-awareness will provide rest and renewal of the spirit to be able to care for others. The setting will be an acute care community organization. The presentation provided in a classroom with PowerPoint for those that are unable to attend the presentation will be available through e-education. The targeted audience identified for the presentation is for an acute care oncology units. The healthcare staff include registered nurses, associate degree nurses, bachelor degree nurses, master's prepared nurses, nurse practitioners, physician assistant, and physicians. The stakeholders include patients' family and board members, employees, organizational financial resources, and the community, which can be affected by the policy and procedures of the organization. The identified outcomes are to fill the gaps in the pain management by providing evidence-based education review that targets the health care staff population to support the interventions to earn accreditations through the DNV. It's important to capture your audience. The generation gap between the traditionals, the baby boomers, the Generation X, and the millennials or the Generation Ys, the differences in the attitude, behavior, expectation, habits, motivation, and ways of communication all vary. Proverbs 21:13, whoever shuts his ears to the cry of the poor will also cry himself and not be hurt. What if someone you love is in pain? We hold true to do unto others, as in Luke 6:3, and just as you want men to do unto you, you also do to them likewise. The literature also reveals that untreated pain causes physiological effects on the respiratory system, the cardiovascular system, the endocrine system, causes decreased immune function, and gastrointestinal system. The psychological effects can cause depression and affect the cognitive function. The assessment tools for patient to describe the intensity of pain is the numeric rating scale, the visual analog scale, the Wong-Baker face scales, and here are some pictures. Pain has many faces. It can be electric, sharp, and can come and go. And the patient can have many different types of pain, a headache, a knee ache. So the focus of this presentation will discuss in brief the different types of medications and their side effects. It is important for the staff to manage these side effects. Patients will be started on a bowel regimen. They'll be given nausea medicine if they need. They'll give sleeping pills when ordered cautiously. Some of the medications cause dizziness and can subside in a few days, and some patients develop a rash or pruritus that can be treated with antihistamines. The focus of this project will discuss in brief the different types of cancer pain. Cancer pain may be caused by many different factors. It can originate from cancer itself, the growing tumor, the effect that cancer has on bones, soft tissue, nervous system, etc. There are many different types of medication classes that can relieve the cancer pain. There are also alternative methods that can be used for pain control, as radiation therapy, cold and heat therapy, physical therapy, cutaneous stimulation therapy. Breakthrough cancer pain can be sudden and transient, clinically significant worsening of the patient's persistent baseline pain, that is controlled by analgesics. It is crucial to assess and document the patient's responses to the pain and the treatment to be able to measure the effectiveness of these types of pain. Reports to the physician for any changes in the patient's pain for further orders such as an adjustment of medication doses or type of medication or any further treatments or evaluations. Ethical considerations is Provision 7, American Nurses Association Code of Ethics, with interpretation as the nurses leaders are responsible to ensure an environment to support the nursing staff performance to create, implement, sustain, and improve the nursing practice standards and patient care models. When pain is not managed, it becomes an ethical issue. The healthcare team is responsible to assess, identify, and provide a plan for treatment. The timeline is to guide the project to meet a 3-year goal. During this time, there will be scheduled updates, meetings, and evaluations quarterly and every 6 months. The staff will closely be involved with their feedback and evaluations of the process in weekly huddles and monthly meetings. This will ensure the sustainability and any recommendations to meet the goals of the organization and compliance to earn accreditation. It is important to collaborate and communicate for the improvement in pain management. The methods of communication are formal and informal communication. Formal communication with staff, nurse leaders, board members, physician. Presentation at monthly manager meetings and updates on progress. Informal communication can be an as needed as an open door policy. The modes of communication can vary through the process, but both formal and informal communications must take place to support the sustainability of the process. Using PowerPoint, emails, meetings, morning huddles, committee meetings will help develop and collaborate with the interdisciplinary teams. Now we'll discuss the financial budget process. Every project affects the budget positively or negatively. The program is cost-effective using the PowerPoint presentation and the hours that are included in the huddles and the meetings that are already in place. This education process is easily incorporated into the activities as an addition to pain management education in the annual updates and the new hire orientation. The evaluation methods are a standard guideline in strategic planning that provide a way to measure the process of improvement for professional performance. They also ensure the project progression of the sequence are on schedule and not to slip back to stay on top, as in Lewin's refreezing for sustainability, to ensure the staff is committed to the educational program and measures the staff's engagement of the process. Audits are another tool that can provide evidence to the stakeholders, the DNV, and provide evidence to the government agencies that provide funding. There are internal and external audits that are important for the organization to support the administration and operations and finances. Other evaluation methods are the dashboard that will track the progress and the program outcomes as needed for improvement in the strategic plan. As per the corrective action plan, the hospital IT department and pharmacy are doing their own audits to determine the compliance to the policy and procedure. In conclusion, the nurse leader can provide ongoing education on pain management with the patient teaching, reassessment, and documentation. The nurse leader needs to guide the sheep, as in the parable Luke 15:3-7, through the pain process to ensure the care of God's children. The parable speaks to me that if one sheep is lost, then to go until it's found, and we will rejoice in the care that we can provide for God's people. Any questions? References?